eliciting patients' ideas, concerns, expectations, and whether a problem has an effect on their life. ICEE is a widely recommended communication technique utilised in patient-centred consulting and forms part of the training curriculum for new GPs, but it is not known how frequently ICEE components are raised in UK GP consultations. In this observational study of 92 video-recorded adult face-to-face GP consultations, the authors recorded whether any of the ICEE components were mentioned, when in the consultation they were raised, and who initiated the dialogue. The study included recordings from the 1 in a Million archive. The archive contains consultations recorded in 2014 to 15 with 23 different GPs and includes linked data such as medical records and post-consultation patient surveys. Most consultations included at least one ICEE component. The most common ICEE component per consultation was patient ideas, followed by concerns, expectations, and then effects on life. The authors also assessed if the GPs directly asked the patients about their ICEE or whether the patient raised them independently or in response to an open question from the GP. For all ICEE components, patients more commonly initiated the ICEE dialogue, and in only 3 consultations did GPs directly ask patients about their expectations. Each consultation and for every problem raised within the consultation were given an ICEE score out of 4 for the number of ICEE components raised. Problems that were acute rather than chronic, or assessed by the older cohort of GPs, were associated with having more ICEE components raised. Problems assessed later in the consultation, or by patients 75 years or older, and from the most deprived compared to the least deprived cohort, were associated with fewer ICEE components. Overall ICEE scores per consultation were not associated with patient satisfaction, but this may have been because 2 components were pulling in opposite directions. The presence of patients' ideas in a consultation were associated with more patients being very satisfied post-consultation, whereas the opposite was true for patient concerns. However, more research is required to explore potential confounding factors. All results are available at bjgpopen.org.